Hello, veterinary friends. Welcome to the Veterinary Life Coach Podcast. Today, I have a wonderful and amazing guest for you. Her name is Dr. Sonja Olson, and Dr. Olson grew up in Maryland. She graduated from Virginia, Maryland Regional College of Veterinary Medicine with a focus on exotic animal and conservation medicine. Her professional path led to over 25 years of practicing clinical, small animal, and exotic emergency medicine. Her professional journey also included formal teaching and mentorship of other veterinary professionals. And currently, she is a full-time veterinary wellness educator, speaker, author, and coach of her own business, Heartstorming Wellness LLC. Welcome to the podcast, Sonja. That was a mouthful, and there's a lot more where that came from. So I'm super excited to introduce you to the audience and get to know you more.
Yay. Thank you, Julie. I'm so delighted to be alongside you for the conversation today.
Welcome. We're going to have a blast. We have just full disclosure for those listening. We did talk one other time, just kind of in private to kind of get our act together. So I know a little bit about Sonja, but I'm going to learn more on this podcast. So I'm excited about that. So my first question to all my guests is to tell me their veterinary story. And you can start wherever you want and tell me as much or as little as you want. But I like to hear everybody's origin story.
Yeah, no, I love that. And we all come from different spaces, but often it's with like the same intent, right? We have a common why, which
Yes.
I think is so. So it, I think, is valuable for folks who maybe, unlike me, I knew from the time I was a little squish, as I say, that I wanted to be a voice for those that maybe I feel deserved care and deserved to be seen as worthy beings. That they weren't in a human package, but they deserved all the stuff. So from a young age, I was very much keen to take that educational journey, which, as all of us know, is not an easy one. You have to keep bringing yourself back to why and stick with it during the challenges. And the work through veterinary school, I actually found that in high school, when I did a senior research project at the National Zoo there in Washington, D.C., I was hooked on the idea of being a part of conservation efforts and wildlife management from the amazing biologists and veterinary professionals that I got to know there at the zoo and the Conservation Research Center. So that really informed where I thought I might go with vet med. I stuck with that actually all the way through college, all the way through veterinary school, and all the way through my internship. I was actually very keen. I put heaps of hours into being at zoos and in conservation efforts, but also at private practices that were doing exotic animal pet care.
Love that. Yeah.
So I put many folks know that National Zoo is just one of many places where there are opportunities, but residencies are a different story. And at the time that I was going through my programs, there was maybe only 6 residencies for zoo in the United States, and it's super duper competitive. I put all my eggs in the basket with National Zoo, and it's a Smithsonian funded residency, which is a little interesting. The residency was mine. They were like, Sonja, it's yours. You've earned it. We want you.
You
And
were there.
the funding fell through
Oh,
by the
man.
time I was ready, the funding fell through. I was like, well,
Disappointing.
this happens and I'll stay close. I'll stay in the area and I'm going to start gaining some clinical competencies and proficiencies. Found an amazing practice in Alexandria Animal Hospital and Emergency where they had a really dynamic GP team of like 14 associates, 9 emergency doctors.
Big
We
hospital.
Big hospital, but what an incredible incubator of mentors with the
Right.
nurses and the doctors for me to practice being an emergency clinician for small animal and exotics. Loved it. And second year, funding fell through a second time for another year.
Yeah.
And so I went through the second year thinking, all right, I'm going to stick with this for another year. But here's the thing is that I found myself really enjoying private practice. And I found that there was a different way to bring my heart and my passions towards veterinary medicine. And one of the things I did not know about myself along the way, 2 things that came forward for me as a person in the profession. Number one is that my nurses that I worked with, both in my internship and in that practice, said, please stay with private practice. We need you. I was like, but why me? Because I have a bedside manner that not everybody has, that
Right.
I really care about clients and educating them and forming that trust and that teaming I didn't know that was unique. So there was that, but I also, over time, experienced the real fulfillment that comes with being a mentor and a teacher. And that has stayed with me all through. But long story short, pivots and decision making, I made the choice to stick with private practice for other reasons as well. It felt aligned with my values and with what the universe was kind of nudging me to do as funding kept
Right,
falling
right.
through.
Especially when it kept falling through. Yeah. It was
Yeah.
telling you that maybe this wasn't meant to be.
Right. So I was at that incubator practice, and as happens to many, 7-year itch, bam, you start hitting a sort of a ceiling of growth, and you're like, I'm ready to stretch again.
Right.
So I was looking for, where can I teach? Where can I be in a space of learning myself as a student, but also contributing to the culture of growth? And I looked for a place that really had that as important collective value, as well as where they were pushing the quality of care and medicine for veterinary patients, that they teamed well with clients and with their referring veterinary community. And I found it. It was Florida Veterinary Specialists in Tampa, Florida. At that time, it was one of the few that had internships and residencies in a private practice environment. Holy cow, talk about a learning environment. Very yummy. Very yummy
Very
for me.
exciting.
And it had also had a robust exotics practice. So that also was rare to have a small animal specialty and emergency with critical care, which was also a baby specialty service in the early 2000s,
Right.
and a robust exotics practice. It was fabulous. So that's where I really grew into leadership opportunities, teaching opportunities, myself learning all the while, of course. But here's the thing, emergency medicine, 12 to 14-hour scheduled shifts, mostly at night, sleep deprivation will get you.
Right.
Whether
Right.
doesn't matter what you're doing as far as like trying to keep yourself whole. And that's really the thing, is that I found myself really leaning into my group fitness teaching. I've been a group fitness coach and teacher for over 20 years, yoga teacher practitioner, meditation teacher practitioner. And even so, my body really communicated very loudly that overnights and I were no longer friends. I had to find a different way. And it gave me the shove, unfortunately, that it took for me to kind of get out of the sense of like, I can't do anything but this. This is
Right.
all I am, and this is my worth in the world. I know, I know for our fellow veterinary professionals, Julie, that that is a scary, scary moment when you have a realization that who you are, you've entangled it so deeply in your doing in vet med that you don't see other pathways. It gets really foggy.
Right. Our identity, I think, is so wrapped up in this job. And I've talked about this before because of the fact that it started so young. Like if you're like you were and I were, that as a child we wanted to be veterinarians and we were like laser focused on that, your whole life becomes getting to that. And then when you're there, you feel like you can't do anything else. That's all you are. And that really does cause a lot of stress in your brain because you can't quite see a way out.
Well, and that's really where I think you and I were bonding over the fact that it required outside expertise.
Mm.
I couldn't see it. I couldn't find my way
Absolutely.
through.
Yeah.
And can I please shout that from the mountaintops? Oh, this whole doctor heal thyself sort of, and that's not just doctors, my veterinary nurses and managers that are listening.
Exactly. Yeah.
We go into a space, we are smart, we are problem solvers, and there are times where you don't know what you don't know.
Hmm.
And it requires a compassionate guide from the outside to help you recognize your wisdom, to see your strengths, and then guide another toolbox fortification with strategies and skills, maybe that you've already been kind of tinkering with, or maybe not at all. And so it gives you then choice of, I am this and I am growing towards this. Don't know exactly what it looks like yet. And that's a little scary for us as type A control freaks.
Right.
You know,
Right.
if I
Yeah.
don't know the path, ooh, boy, that feels a little sketchy.
Yes. Yeah. Well, I think and you're kind of touching on it. It's like getting that outside influence, your coach, your therapist, or someone that understands kind of where you're at and also understands that these people like us that coach, we don't have the answers for you. You have your own answers, but what we do is we help you unlock them. Because when you're in that space, and I've been there before when I was trying to decide what I wanted to do after I was a hospital owner, what was my next, venture in life before I got into this, you need someone else to help you figure out the solution because it's in there. You just don't see it.
Exactly. And let's also just make certain that folks that are listening, there's some other things that may be playing against you. Number one is if you are anywhere on the burnout spectrum, your energies are low. And what is also interesting is that if you've also been in a place of being bored, underdeveloped, underappreciated, you may also be experiencing bore out, which causes
I
us to
love that.
go,
I've not heard that word before, but
yeah,
it's
it's
true.
an
It's
actual
the truth, right?
phenomenon that
Yeah.
contributes to burnout in that we are bored. We
Yes.
are languishing. And as highly intellectual community, we thrive on learning. For most of us, it's in our top five values. Like,
Right.
oh, and we get such dopamine kicks from learning. We love it.
That's why we love conferences so much, right?
We really do.
I know I
So
love
if you
conferences.
Right. If you're in a space where you're not learning and you don't feel like you are utilizing all the skills that you're capable of, or you just get to a place where you don't even know,
Not
nobody's
challenged.
asking you or stretching you, well, then that can be a place where you can physically go into a low energy state. This is physics happening on the
Mhm.
inside, and
Right.
it becomes onerous and hard and heavy. Feels like you're dragging a heavy sled of rocks behind you. And you're
Yes.
like, I can feel it and I'm tired, but I don't know what to do other than putting one foot in front of the other and to keep moving or to just freeze
Right.
and feel
Or
overwhelmed and don't know what to do.
And do you think that anxiety can be tied up in that? Because I think for me, that's how it showed up. I
Mm,
started to become anxious, and I'm not a highly anxious person, or I didn't think I was
mm.
until I started to get that boredom. I never felt burned out, but I did constantly want to do something different. Like that's kind of how I was wired. So I was always taking on new challenges. But when I got to the point where I wasn't sure what my next challenge was, I started to feel that what'd you call it? Bored
Bore
out.
out, bore out.
Yeah,
Yeah.
I mean, that's exactly accurate because I did, but then it showed up in anxiety.
Mm.
And that was interesting to me. I was like, why am I so anxious all the time? It was because I was bored and I didn't know the way out.
Right on, Julie. No, I'm glad you're calling that forward as well, because you don't have to have a clinical diagnosis of anxiety or tendencies towards anxiety to experience it in moments of lack of clarity, indecision, lack of resources. And
Yes.
in that moment, the anxiety that we're experiencing is very akin to a panic of, oh gosh, now what?
Yeah. Now what do I do?
Now what? And
Yeah.
that is a moment for those that are on this space of journey and I don't know who I am yet. I really love adding that word onto things. I don't know yet. I don't know where I'm going yet. It's really been a part of my work to temper my impatience and my want to know, because that's what we do as
Right.
medical practitioners.
We're
It's
very
what we've been
impatient.
conditioned to do is
Right.
to really seek the knowing and to have clarity and to understand the path. We see everything in algorithms. This, don't do. And when
Right.
that isn't available to us, anxiety can set in.
Absolutely. Yeah.
Mm.
Yeah. So tell me how, let's talk a little bit about how someone that's feeling that way right now, feeling burned out or bored out or anxious or whatever it is that isn't comfortable or isn't feel like it's going the way that they thought it would in their profession. Talk about how you might get started with trying to figure this all out. I mean, obviously get a coach, but beyond that, what can people
I'm
do?
going to go back even another step, because the
Okay.
first step in it is giving yourself some grace.
Ah, I love that. Yeah.
When we started our conversation today, I shared that the first thing I do in my morning is I have a meditation practice. And very intentionally today, I've visited it in so many ways. I talk about it as a regular mindfulness topic is self-compassion. And just
Yes.
really briefly, I love bringing Kristen Neff's three elements. If people don't know who Kristen Neff is, she's a world-renowned researcher, author, speaker on self-compassion. And her TED Talks are phenomenal. But Kristen Neff talks about there being three really important elements to the self-compassion package that I'd love for folks to just consider. Number one is the mindfulness piece, which simply means what's going on, what's true in this moment. And can we ease back on the judgment of that and the self-criticism of that and simply go, this is what is so. And I love the phrase, right now it's like this. What is
Hmm.
it that I'm experiencing? Where are my emotions, my thought patterns, my beliefs? Really taking stock of that. That requires some reflection. And yes, it's helpful to do that with some guidance with therapist, coach, mentor, but it does start with you being willing to
Sure.
go into
Yeah.
that space. Number two is recognizing you're not alone. Number one, you're part of a much larger community of humans who have ups and downs in their lives. That is inevitable. That's part of being alive. The nature of our mind is also that we have evolutionary habits to glom onto the negative, to have a hard time seeing the positive, to be uncomfortable with change. Hello, my
Yeah.
human.
That's my Chihuahua brain. That's what I call the Chihuahua brain. It's
Hello,
that
humans.
primitive brain, and it doesn't like all the things.
Yeah, so we just recognize that that is so, and part of your veterinary community, that there are many things that are part of us, individuals and collectively, that we have shared similar personality traits and tendencies. Our perfectionist tendencies, our neuroticism is another personality trait that research has brought forward. We worry a lot, we doom and gloom, and what if
Yes.
quite a lot. It
Hmm.
helps us as clinicians because we're forward thinking.
Right, right.
In our lives, however, maybe not so much. So
It
common
stops us from
humanity.
taking action sometimes. Yeah.
That's right, Julie. That's right. So if we're stuck in the worry cycle, I think of it like a washing machine cycle. That's just going round and round,
You're on the
and the
spin
suds,
cycle. It
and
feels
you
like it.
can't see. Where's the
Right.
rinse? Where's the rinse?
Yeah.
So that's the common humanity bucket. And the third bucket, which is a really tender one and vulnerable one for folks, is really taking a moment to demonstrate some self-kindness.
Mm.
And recognizing you're doing the best you can, and you don't have to do it by yourself. Veterinary professionals asking for help, the research is just abundant around this. We suck at asking for
Yeah.
help.
Right. But it makes medicine so much more joyful if you do collaborate.
That's the thing is, there you go, Julie. It's a strength. When we're in the clinic, we know that we are smarter than me when it comes
Yes.
to co-managing a case. And it's because we want the best outcome possible for that pet and that family. We are
Right.
connected to that why, and so we're willing to ask for help.
Yes.
So what happens when it comes to applying that to ourselves when something needs healing and we're suffering? Why don't we feel like we can also ask for help from our community of compassionate peers who get it?
Yeah.
So, peer support is enormously important in today's conversations, and I'm delighted to hear it bubbling up around internal practice wellness champions as peer supporters, people who are doing additional training and upskilling and understanding mental health challenges, etc. So, as a team, being prepared and informed, staying in our lane, let's be really clear, in our
Right.
lane, having the ability to also call upon mental health professionals who are absolutely available to us, because guess what? We're humans, right? And then
Yes.
inside vet med and outside of vet med, looking at mentors and coaches. So
Yes.
there are abundant resources, and it's up to us to know when and what, and then lean in.
Yeah. I think I think it's that stigma of admitting that you're not perfect because we are such perfectionists that keeps us from asking for help in a lot of ways. However, when you do go to get help, it is very humbling, but it's also very powerful.
Mm.
And I mean, I started with life coaching. I've also gotten some, well, I guess I got some therapy a while back when my son was very troubled and I didn't know what to do. And I'm like, well, I guess I'm going to therapy because I can't get him to go. And but so it's a little bit humbling when you first start, and it's a little bit scary and it's a little bit intimidating, but it can help you so much. Just realize that you're normal and that you're just processing whatever's happening in your life right now, and you can get through it and understand yourself better, and then you have more tools, so when something happens again, you're better. It doesn't mean that you don't need help again, but it also means that you understand that going for help, whether it's from a therapist or a coach, someone in the profession or out of the profession, how powerful it can be. I
I
just,
almost have like this vision of like a graph that's going up with like little, humps going up and
yeah,
up.
which is life, right?
Right? It's
Life
going,
is
and
good and
each
bad.
time if you are putting in the effort yourself to do the reflective work, to apply the tools and strategies that you're learning along the way and activate them, what happens is we are learning more and more about neuroplasticity. And we
Yes,
literally can change our neurologic processes with practice and intention and awareness and a whole lot of compassion. So as we go forward,
you
but
have
you're
to
going to
keep coming back
stumble.
to compassion, right? For
Right, because you're
yourself
gonna
mostly.
stumble. It's not
Yeah,
perfect. And
yeah,
can we maybe relax around this concept of making mistakes? How does progress happen? How does
right.
innovation
You have
happen?
to make mistakes,
You must make mistakes,
right?
and it's not fun. It's really uncomfortable,
No,
and
it
it
feels
means that
terrible.
we're not perfect. Oh, dang, here we go again. But really, one of my top values I've learned over time also, and it really fits me as an emergency clinician, is I love efficiency. I really love efficiency. And so I'm also about optimization. Oh, I love that word. How do we optimize what we've got today and then some? So contributing to the already awesome human that you are, showing up in the world in the way that meets you where you are today in the season of your life, because that will also continue to change. But coming forward from a place of feeling resourced, as our social work community would say, right? Resourced internally. I know what to do when. I've been practicing, I've got strategies and external resources. I know these are the places that I can go for knowledge, for support, etc., when I need it. When I'm
Right,
up against, for example, as a parent, something I've not gone through before, and how could I possibly know? So I'm going to reach out to community of wisdom.
right.
Mm.
Yeah. Well, and I think too, when you do this work and you put yourself in that position of getting coached or, trying to develop yourself with your mindfulness and getting those tools, it makes you so much more compassionate to others around you, the people that you work with, the clients. You can handle their neuroses, for lack of a better word. You can handle their anger or their frustration or whatever negative emotion they're throwing at you so much better when you have learned to handle it in yourself.
Ooh, you're touching on something really, really important
Oh,
because I
good.
think,
Take off with it.
well, I'm just thinking about why we have collectively, this is not a judgment. It's just we each do it in different ways because we have undone work or something within ourselves that we don't want to look at or touch. And it's mirrored in front of us by another
Mm,
human and
yes.
makes us really uncomfortable. And we backpedal as quickly as we can away from it. And we make that human wrong because we don't want it necessarily to be too close to us.
Oh,
There's
yeah.
something that it's stirring up in us, whether it's something that we feel is part of us or it's something we've experienced. So a trigger of sorts.
Yes.
So what you're it's on the flip side of that coin is what if we come to a place of understanding and acceptance and compassion with this is the work I'm doing and what's that human working through? And maybe softening a bit and giving more grace to ourselves and as a result, more grace to others that are on their own journey. We don't have to know why it is they're showing up the way they are in that moment. But wow, that looks like that's tough. Wow, that's hard. Look at the negative emotions that human's going through. They're really suffering. Boom, right into our caregiving, compassionate heart.
Yes.
So I think the more, like you say, the more we practice this giving grace and compassion, it's more available to us, but it also becomes more available not just to the people in our practices that we work alongside, the clients that we support, but how about all the other humans in your life, right?
Yes, absolutely. Yeah, I was just talking about the Christmas like family gatherings and how every family has dysfunction, and and my family's no different. And I'm like, okay, here we go. Every time there's a gathering or a holiday or something, you have to kind of deal with all the other humans that and their families, so you don't have a real choice of who you want to deal with and who you don't a lot of times. And so, yeah, just having that compassion for yourself in those moments when you're starting to feel stressed out about that, and then you can be more compassionate to them as well.
And you brought up just that is so perfect. Our timing on this is so
Oh,
fantastic
good.
because
We're good at this then,
we're
huh?
good at this, but here we are in a season of feeling like there's a lot of things that are outside of our control.
Mm,
It's the holiday season. There may be a lot of things that get stirred up for you and or for others. Remembering that not everybody has the same experience. So maybe there's some big feelings that show up for people, making them less skillful. Their behaviors may show up in different ways. And so being just aware of that right now. And we also are living in the climate of America going into
that
a
has been a
very,
rough thing lately, right? With
it's
the
a rough
election
thing.
year, that has been rough for everyone.
I don't think we can ignore the fact, let's just be clear, that most of us are not okay right now as we're navigating what will be next for us in our lives while living in this country. And I
Yeah.
don't care where you are on your political beliefs. It's just that there's, again, that feeling of unsettled, sort of, we don't know yet. And with that, there's a lot of the worry cycle churning in the background for us. So if that's true, if that's just in the background, the only thing, Julie, I know you know this, we say it 1,000 times, the only thing we ever get to control is ourselves and how we show up and being very gentle. Slow it down enough that you can pause, take a breath, and respond as opposed to react in circumstances that show up, particularly when we're feeling low on energy, we're feeling stretched with regards to time. All those things push us into less skillful, reactive spaces. So, who do you want to be around the holidays? Take giving some thought to that as you go into a gathering of people. Who am I? Who do I want to be in this place? How do I want to be remembered? So, after the party, how will I feel? What am I taking away? What am I looking forward to? And what is it that folks will have gained from being in my presence? What am I hoping to
I
offer
love
them?
that. Yeah. I love that so much because a lot of times we think that if somebody is rude or, you know, not self-aware, or that if we feel triggered, that we have to respond or we have to fight or that we can't just like let it go in one ear and out the other, because then it means something about us. And I
Mhm.
think if you decide beforehand that no matter what happens in this gathering, if people are arguing or fighting or they don't like my cooking or whatever, or they start talking politics and they don't agree with me, that if you can just like be open to all of it and just be present, that your holidays or whatever gathering you're at will be so much less stressful.
Well, and if you offer yourself, for an example, myself, one of the things I really try to bring forward is I would like to be a place like an oasis of
People feel
slowing
safe.
down, of calm, of
Yeah.
safety, exactly right, where folks may be going through stuff. And not that I'm here for you to vent and puke your stuff all over. That's not what I mean. Okay. I'm here
Which
for you
will
to vent,
happen.
which can happen. That's right. You've got to put your boundaries up. Let's be clear
Right.
about that. But
Yeah.
what I am saying is that you can be a place of kindness. You can be a place of modeling the behavior you wish to see in the world.
That works too, doesn't it?
It's,
Yeah.
this is a really cool thing that we as humans should know is that mirror neurons and the desire evolutionarily for humans to attune energetically what energy are you bringing to the party? So
Mhm.
what if you could perhaps bring an energy that helps to offset any buzzy, edgy, hard energy? So we all have been in those circumstances at work and our lives where we were feeling one way and wow, all of a sudden this big negative emotional tidal wave shows up. It's natural, and that's part of our human sort of resonating with one another, where we go into, oh, whoa, this sounds like something I need to pay attention to. Sympathetic nervous system,
Maybe I should be
ping.
upset too.
Maybe I should be fearful. Maybe I should be paying attention to this. It's actually a really normal human response. Doesn't mean
Right,
you have to go there.
right.
So
You can
that's you
feel
going,
it.
oh,
I used to say with clients, because I always say that I like conflict, and it's kind of a learned skill. Like because I've done it for so many years, I do kind of enjoy it, but not from the sense of the fighting part. I
mm,
like the challenge of getting to the resolution. Like that's what I like about conflict. But you can feel when somebody's angry and they're throwing all that negative, you can feel that adrenaline, that cortisol, that and I would always feel it. And then I'd be like, okay, well, don't react, like let this go. Calm, be calm. And so you kind of have to talk yourself into not taking on that negative energy and that anger or whatever they're bringing at you. So your natural brain is going to want to go there, but then you're going to have to train your brain not to go there. And so I would just say to myself, okay, just be calm. Just be calm. Just be
and I'm
calm.
going to add another C. We've
Just be
talked
calm.
about calm, well, gosh, it's all about the C days: centered,
Yes.
calm, compassion, and curious.
Yes. I love
So
that
when it
one.
comes to conflict and
Yes.
something is going on over there, boy, I'll tell you, nothing, especially veterinary professionals, as I mentioned, we are such curious creatures. We want to know what's going on. And quite truthfully, underneath it all, you do care and you want to help.
Right.
Maybe it's different levels with different situations,
With different people.
different people, it may be more available to you than others,
Yeah.
but it's our nature to give a crap. We do.
Right.
We care
Yes.
a lot about
Yeah, That's
suffering.
why that's why we get damaged so easily.
That's right. And
We're
so that's
highly compassionate people and yeah,
it's the flip side of that, right? Is that we
right.
have to be aware and careful of our caregiving. So boundaries once again around that. And so that we are resourcing ourselves, caring for ourselves, and understanding the difference, truthfully, between empathy and compassion, because they are different. So the new language these days, neurologically more appropriate, is empathic strain as opposed to compassion fatigue. Because what is being strained, honestly, is when we are empathetic to the point where we let things in that aren't ours, and we take in emotions and physical experiences as a result, and we take them home with us, not even recognizing we let them in.
Right.
So compassion is the antidote to that, as is curiosity. So it's really compassion for the other, compassion for myself. Whoa, what's here? Is this mine? Whoa,
Do
what
I
is this?
need this? Is this something I want to take home?
And if not, how do I move through it? And
Right.
here we come back to peer supporters. How do we as a community doing really beautiful but hard work support one another in the moments, in between the cases, before we go home, from our shift and go back to the rest of our lives and the people and the animals that love us? How do we process some of that in situ together with people who get it? They were there, or they
Yes.
understand it because they've been there at
Yeah.
another point. I feel like this is a beautiful place of culture cultivation for us in general in vet med, recognizing that we do not have to be the independent little soldiers doing our work in our little silo. I love the idea of people when they're doing orientations and onboarding, of doing like cross training and really getting clear on what everybody else on your team is doing and what their stressors are. Love inviting in people who have real skill around client communication to be our mentors for those that maybe aren't as skillful. And as you say, conflict is not somebody's cup of tea as much as it is maybe for you. But
Right.
you've practiced with it and you've come to see it through a different framework, which is opportunity.
Right.
And
Yeah.
that takes some skill and practice. And I think there are teammates that we likely have who have more awareness skill around it already to teach us.
Yes.
So I feel like genuinely we have so much around us to grab hold of And we don't have to go it alone.
Right. It's an absolutely learned skill, I think, conflict resolution. It's absolutely something that you can learn and practice. Because when
Mm.
people tell me that they hate conflict, I'm like, yeah, everyone does. Like, that's normal. Nobody wants to be in a fight. However, when you say conflict, really what you're saying is you don't like to go into that situation where someone's highly emotional and you have to resolve it. But if you can get better at that and not taking on all that negative emotion and staying calm, it will be easier for you to get them through it.
And
So
that,
it's this learned skill.
yeah, and I love you just pointed to something else that we tend to do as, again, as medical practitioners, we like to fix.
Yes,
We've been conditioned to fix.
absolutely.
We don't fix humans. We don't fix emotions. We
Right,
cannot change in the moment someone's beliefs or their biases. Knowing that those are true and are the filter that the conversation is going through,
right.
and what are their values compared to my values.
Correct.
So getting again into the space of like, whoa, what is it exactly that's raising up our armor? Why are we disagreeing about this? What
Yeah,
is it that's not being said?
right,
And that again is just slowing it down enough to go, huh, what is this? You do not have to fix. You do not have to take care of that person's emotion or remove their suffering. That is not your role. That is in conflict. It is to maybe take steps towards a resolution that in the moment, with the knowledge that we have and the resources that we have, is the best solution for now.
right.
And that's not a comfortable place for us to really land in either, because then again, we go, well, wait a minute. Am I compromising? Are they compromising? It's not perfect. And
Right.
and in America, I want to win. You
Yes.
know, we have
Yes.
this win mentality as
Right.
well. So just noticing that those are all cultural conditions that are showing up in there from
Right.
being an American, from your own cultural background, and then from going through a rigorous training and practice of certain tendencies and things that we do to our medical caregiving. And then we try to plug that in. And so I love, there was a, conversation I was having with mentors. So I'm a mentor vet, mentor and facilitator. And one of the conversations we often have is around this, about conflict navigation. And one of the most essential pieces, and you know this as a coach, Julie, is how we listen.
Yes.
So am I listening to win? And like I'm already formulating my response,
Argument.
my argument, my debate, how I'm going to one up you and be right. Am I listening to fix or am I listening to learn? I mean, that's really helpful to just recognize, what is it that I'm doing right now? It's not that necessarily there's no need to go into judgment. It's just noticing and maybe choosing in that moment what is the most aligned approach, what's going to be likely to land you in a resolution for the situation that will really feel like you were present, your values were present, your intentions were here, so that you can come away from that situation going, well, in that moment I did the best that I could, really.
Right. Right. And it's not always gonna be resolved the way you would like it to be. But if you were present and you did the best you could for that person and they just weren't able for whatever reason to accept it or come down off of their high emotion, it's still all okay as long as you were able to stay present and help them to the best of your ability, I think.
So that is a beautiful point of a coach. You said it before. I can't do this work for you. I can guide you. I can hold space for you. I can ask really thoughtful, powerful, open-ended questions to get your internal cogs turning.
Hmm.
And in that coaching conversation, it's likely that we're not going to have the immediate ahas. The ahas happen between our coaching conversations where there's a little bit of time to process and reflect. And maybe the coach has given you some homework. And
Yes.
with those pieces, you come along the way going, oh, and it's little glimmers, y'all, as far as like when we start to have these like aha moments of, oh, wait a minute, I do this and that is not helpful, or
Right.
I do this and it helps. I
Yes.
actually want to do more of that.
Right.
So that when you come back together with your coach, it's really quite, I don't know about you, but my heart is just filled up when I have somebody that I'm coaching or mentoring say, do you know what I realized? And I couldn't wait to share it with you, that
Yeah.
I saw it this way. That's the stuff that sticks. I can't spoon feed it to you and have it stick with you. You need to see it for yourself and see why it matters and why it's important and relevant to you for it to be integrated into your life. And I think that's the power of having skillful coaches and mentors and therapists in your life.
Yeah. I think that's a great point because being somebody that's been coached quite a bit since I started life coaching, because obviously I had to learn how to do it. So I got coached first and then went through all that. And I've been doing it a long time. I like to remind people that when you go to get coached, if you haven't been coached before, there are days when you feel worse after being coached and you hang up that call, you feel worse than you did when you got on the call. And that's okay because what's happening is you're starting to learn about yourself, but you're still not, you don't have the light bulb yet. So sometimes as you're being coached, somebody will say something and you'll go, whoa. And it'll just be a random thing, but you'll be like, oh, yeah, that hits home. Or
Mhm.
you might hang up a call and be like, oh, this isn't good. I've had people that I've coached, once or twice, and they're like, well, it's really not helping me. And I'll say, well, kind of give it some time because sometimes it takes a long time to unlock what's going on in your brain. And I don't know what the magic number of times that you're going to have to be with a coach that it's going to help you. But if you stick with it and you keep trusting the process, something will unlock and something will you'll start to feel better and you'll start to feel, I don't want to say in control because I don't like that control freakishness that we have, but you'll just start to feel more understanding of yourself and how you react to different situations and how you show up and the things that your Chihuahua brain tells you because we all have these stories that we keep telling ourselves over and over again from childhood or whatever, and you'll start to understand that. And that's what's powerful about coaching is it doesn't like every time you get on a phone call with a coach, you're not going to get off and be like, okay, I got it. I've got life figured out.
Well, and I love the image that comes to my mind, and I've read it, and it's shown up in my coaching course, that I did for my coaching degree, and it's imagining that you are looking at a park, right? And you see a footpath, and that footpath has been worn by many feet. But there are other ways to get to a destination nearby that is beautiful and offers new perspective. It requires you coming off of that well-trod, safe, clear path and treading through grass and rocks and unforeseen routes that might trip you. But you're on your own journey of discovery and a new perspective. And so it's just a way of, again, bringing attention to, we go with what feels safe. We go with what's known. And that's a really important call out for us as humans in general, some people more than others. Choose what's safe and known over what actually may be healthier and better for you in the long run, because
Right.
it's going to require energy and work. That's part of it. So there's all the I don't want us, I don't have the time, I don't have the energy. There's also a lot of resistance. And the word, when you were talking just a moment ago, the word that showed up as I was remembering being with my life coach that helped me during that important part of coming off the ER clinician floor, and who is Sonja going to be next with all that I've learned and all that I care about now? Where am I going? Oh my gosh, resistance. Holy cow, there was so much resistance and justification and don't you know? And wow, I caught myself
Surprise
again in,
yourself, right?
yes, where I was like, whoa, Sonja, why are you so, in a state over this particular thing? I was so defensive. Because I was defending what I believed to be true and I was feeling very vulnerable. So my defensive tendencies were really heightened. So just know that again, when you're doing these things, that's really normal. That's
Yeah,
really
you'll feel
normal.
it. You'll feel like, oh, this isn't fun. Yeah.
It's not always fun.
No,
Well,
it isn't always fun getting coached, but it's always useful, which is fun to me. But when you come back later and you go, oh, I had an aha moment, and you're like, okay, that's cool.
I love one of the examples I use that's a very gentle one is my coach. It was just I've journaled off and on throughout the course of my life. Sometimes it's helpful. Sometimes I find it's just another to do and I don't want to do it.
Sure. Yeah.
But she was really bringing me back to the power of journaling and with the intention of the power of gratitude. And so there's heaps of research around gratitude and how it shifts your neurophysiology into a space that is more calm and centered and dopamine, serotonin rich to offset cortisol, invites in your parasympathetic nervous system. So there's whether you speak it, whether you are writing it, and you use your own words, it doesn't have to be I am grateful for, I'm appreciative of, I'm just thinking of this and I'm glad for it,
Right.
whatever your words are. But the word that my life coach, Victoria, brought towards me is, what are you celebrating? And I had
Mm,
such a strong reaction to it. I was
that's
like,
a cool one. Yeah.
I didn't like it. I didn't like
Oh,
it at
you
all.
didn't. Oh,
No, I
okay.
had such a reaction to that's for like special occasions.
Like you
And
didn't like that word at all. That's funny.
because I thought celebration seems grandiose and
Right.
it's, saved for the, you know, celebration of life, celebration of an accomplishment, celebration of a goal hard won, not for an everyday celebrating for getting out of bed and putting on my pants.
Right.
It's like,
It seems ridiculous. Yeah.
it's like, yay, me that I brushed my teeth today. But she was playing with it. So it was
Yeah.
offering me, first of all, to not take things so freaking seriously, because I recognize now I have a tendency to do that.
To do that. Yeah.
So to be more playful with things and have a sense of humor about my own sort of like quirks around this. So it became a
Exactly.
game. It became a game for
Yeah.
me to play with the concept of celebration until I softened around the concept. And now I have a very different relationship with the word celebration.
Yeah, I love that though, because there's something about that word that triggered you. To me, it sounded fun. I was like, oh yeah, I like that because I like dancing around and doing the Rocky dance or whatever when something fun happens. But for you, it was a word and you had to explore why. Why does that trigger me?
And I think in that moment, I was in such a place of, um, oh, I was feeling really down and I was feeling really down on myself. And I know this is true of other caregivers, not just in vet med. But I've heard it from other vet med professionals
Yes.
that when we are moving from a role that we thought was going to be our entire professional destiny, there is a grieving that is happening. And you are letting go of who you thought you were going to be forever. You maybe are grieving that you don't have the strength and the physical wherewithal to do what you did in your 30s, maybe, right? Or some health
Yes.
concern comes
Yeah.
along that you're like, I'm not physically able to do that anymore,
Right.
or just whatever it may be. It is really valuable for folks to know that some of what you are going to go through is a grief process and a letting go of, to make room for what is next.
Right.
So it's not that you're pushing it away or dismissing it or making it wrong. Not at all. It's you processing and gathering what is learned and what you care about, and then slowly but surely releasing the pain.
Yes.
But when you grieve, it's because you care. So whether it's about a plant, an animal, a human, a health status, a
Yeah.
professional role that you are in. Maybe it's something that you are ready and recognizing you're looking forward to something that is next. You're still, whether you know it or not, you're going through a grieving process of leaving this other you behind.
Yes. Yeah, that absolutely happened to me when I was deciding what I was going to do, once my kids grew up. And then I was like, okay, do I want to keep owning my hospital or do I want to start to think about retirement and going through all of that? It absolutely, you're excited. But then once you pull that trigger and you decide you're going to make a big change like that, you do very much grieve the past and what you were almost, it feels like. Well, I was that, and now I'm no longer that. And that goes back to we're so tied up in being a veterinarian and me, I was a hospital owner and that was very much my
Mm,
my identity. I was a veterinary hospital owner because that was a big goal for me. And
Yeah.
so, for over 20 years, I was that. And then I had to kind of let that go. And it's very difficult. It's not an easy thing to do.
And yet it is still very much a part of who you are, Julie,
Yes,
right?
absolutely.
It
Yeah.
informs you as a human, as a coach, as a veterinary colleague. It brings you into a place of understanding and relatability that is really precious. And
Yes.
that's bringing back the power of peer support and collegial compassion, whether that's just as a friend, a colleague that sees each other and says, wow, you're going through stuff. And
Right.
I'm here. I don't understand exactly what it is for you, but
Right.
I know what my experience was like.
Listen. Yeah.
So you can be in that space without formal credentials or additional, upskilling because it may not be something you want to do, but you can still
Right.
show up as a really caring human in vet med who's gone
Sure.
through stuff and you see somebody struggling. You can probably be of support, not fixing.
Yeah.
You're
Yeah.
there to walk alongside and say, you're not alone. You're not
Right.
alone. And I love also something that you were saying is about our capacity to pivot. And I don't know about you, Julie, but I'm a veterinarian down to my cellular DNA.
Oh, I have such a hard time when people ask me what I do
Mm-hmm.
because I'm a life coach now and I'm a retired veterinarian, but I still do relief work. I have a really hard time saying I'm retired or I was a veterinarian because I still am.
You
And
are a
I have
veterinarian.
a really hard time with that. It's so true.
So it's like, what do we individually, and then what do we as a community mean that to be?
Right.
What is it, the criteria that we
Yeah.
somehow believe? And I mean, this is for me showing up from my family, from friends, from colleagues.
Right.
Don't you miss being a veterinarian? I'm like, when did I leave it? Like,
Exactly.
do I
Right. I
miss being a
still am.
clinical veterinarian? Is that what
Yes.
you're asking?
Yes.
Well, there are parts of being a clinical veterinarian that I miss. I miss working
Sure.
with the team. I
Yeah.
miss problem solving. I
Yeah.
miss when we work together and we have real beautiful success around winning and helping an animal and a family.
Right.
Those things I miss.
Yes.
Do I miss the hours? Do I miss the empathic strain and the
Right.
navigating of big, hard emotions that shows up? That's part of the occupational hazard landscape of being a veterinary
Right.
caregiver.
Right.
I do not miss those.
Yes.
So I'm in a space of being a veterinarian who helps other veterinary professionals in all the different stages of their journey in whatever they're doing, because you
Yes.
don't have to always be in a clinical environment to contribute for crying out loud. Come on
Right.
now.
Right. Yeah. And I think that's changing, which I like so much. I want people to stay in clinical medicine because I'm worried that everybody wanting to get out is going to collapse the profession on some level. I'd like people to kind of want to do that, which I think it's still happening. But when you were talking about the peer support thing, something occurred to me that I wanted to ask you, because I love that idea. How do you prevent the peer support concept? And I mean peer to peer, from turning into the dumping ground of
Mm.
all the horrible stories, because that's
Oh,
what
yeah.
disturbs me is when I'm online and this one person tells their terrible story and then the other people jump on it and yeah, clients suck. And you know I understand wanting to share with other professionals, but how do you keep that peer support helpful and not turning into like all of veterinary medicine is awful and terrible and
I love that call out because when I talk about peer support, I'm not talking about just the awful, icky, sticky, hard stuff that we do.
right.
It could be that there was a medical mistake. It could be that
Yes.
there was a really challenging conversation where a client just laid into you, um, and you didn't deserve to be treated that way.
Right.
So peer support can show up as, wow, that was really challenging. Do you want to talk about it? Or with a medical mistake, let's talk this through. Let's understand
Yes.
it. And so that we all can learn. So
Yeah.
debriefing as a one-on-one, debriefing as a community in a very intentional, skillful way, in the right timing and place, that's peer support. But
Right.
what you're pointing to is also important and is tricky for our veterinary professionals to recognize. Not everybody has the same language, but what you're talking about is secondary traumatic stress.
Yes,
And what
absolutely.
we're doing, and in the language of those that spend time in this, researching it and speaking on it, you're sliming each other. You're sliming each other. You maybe bring it home and dump it on your partners, or you dump it on people who care about you because they love you and they want to hold space for you. And you just go, "Bleh," and you vomit all of this hard stuff that you went through. They don't have the perspective. They don't know what to do to help you.
The
And so all
tools.
you did was offload your pain onto somebody else so that you could feel lighter. And that's not okay. We need to have
Right.
some, I think, some real ethical responsibility about what we're doing. Inside our veterinary hospitals, we are trauma soaked from our outside of our work lives, small t, big T traumas, as
Right.
well as in the work that we do every day. There are small t and big T traumas.
Sure.
So maybe we can bring some responsibility and awareness and accountability around not contributing further to it. Instead, having skillful, what's called low impact debriefing.
Mm.
So that's coming from the social workspace where they talk about may asking permission, can I share this with you? Is now a good time? I need about 5 minutes. And being thoughtful then of what it is that you need to share and what you don't need to share so that you can maybe have some opportunity to work through the emotions you're experiencing, the physical sensations. You can integrate the learning, move on with your day, move on into a space that's healthier for you. Yes, yes, yes. All very good. And that toolbox of low impact debriefing strategies is not something that we have been taught in veterinary training
No.
spaces. We are not talking about it through onboarding. We're not talking about it in team meetings, and we need to.
Yes, absolutely. So that's a really good transition for me, I think, to because I want to talk about this before we're done with this podcast, is to lean into or lead into what's the future of this? What's the
Mm.
future of I think it's bright because I think more and more people are understanding how valuable coaching is. But for the next, year to 5 years in vet med, what do you see as where we're going? What's good about it? What's bad about it? Where we need to go? Those kind of things.
We're clearly in the thick of evolution, right? And there's a lot that's unknown for us. And again, here we go again with ambiguity, and we don't love that. Can we reframe the conversation towards we don't know yet? So, what do we know? We are now more informed than ever with the Merck well-being studies, with other really fantastic vet-centric research papers that have been coming out. What books have shown up? Oh my gosh, so many veterinary authors are showing up around their shared experience, but also what wisdom and strategies, not just let me just tell you what it was for me. It's what I've learned and what might be helpful for you. So I'm really excited about this opportunity for people to see that they have something to share in their voice, really inviting in that diversity, equity, inclusion conversation that we've been bringing forward, and utilizing that psychological safety language of building trust, of finding a space of humility and curiosity about who we are, not just as vet professionals, but who are we entirely, and honoring that, giving ourselves permission to be more than just the doing in our work role. So I'm seeing that happen. Our younger generation of veterinary professionals is really shifting what we believe the work needs to look like, the
Yes.
scheduling, really pushing us, those that are less
Boundaries.
comfortable around technology,
Yes.
myself included. But technology can be really, really helpful.
Yes.
Voice, doing medical records in a more skillfully, effective, efficient way. Heck yes, doing treatment sheets in a way that we're less likely to make medical mistakes, where we are communicating more effectively as a team. So I feel like the future is moving towards us being perhaps more skillful and compassionate and aware as a community around how we do medicine, how we support our clients as humans doing the best they can with spectrum of care conversations, and really leaning into that you don't have to be in a clinical seat to have a voice and an impact on the greater conversation of where sustainable veterinary medicine is going. So I love the idea that we are collaborating rather than competing. We lean into that compassionate heart that we have for ourselves and for each other, and not making ourselves or others wrong around that. So continuing to chip away at that stigma. And what I feel like we're also up against is really, dare I say, veterinarians taking veterinary medicine back.
Yes, I love that.
I feel veterinary professionals. I don't want to mean
Right.
just veterinarians. I think
Right.
veterinary professionals taking veterinary medicine back, owning the culture, owning the quality of medical care, and our ability to really flourish financially, professionally, etc. We deserve it. We deserve it. And we
Yes.
know how. We do not need to necessarily make ourselves small in
Right.
these conversations. So it's a challenge. We are up and in it right now.
Yes.
So, but get
Yeah.
involved where you feel called to get involved. For those that are listening, contribute where you can, influence where you can. But the one thing you always, always have the opportunity to have say so over is, who are you? And if you sense that you are in a space where you need some fortification, some support, some shifts from what you've been doing because it no longer serves, ask for the help.
Yes. Yeah. And I would add to that when you said you talking about who you are, I just like to share that you are unique and you are worthy regardless of where you are at in this journey. If you're feeling depressed, if you're feeling, not whole, or whatever the feelings are, you belong here and you're very needed in this profession, right? Like we need all of them. We need everyone.
We do. And it's exactly said, just said it beautifully, Julie. You
Yeah.
belong, and all of us are needed in the different ways that we show up to contribute our perspective, our wisdom, our compassion, our strength towards what we all dream of for ourselves and for VetMed going forward. Because quite truthfully, the animals are relying on us.
Yes.
When it
And
comes right down,
the
let's come back to our why.
yeah, the people that own those animals. So tell me the name of your book so people can look for it. And I have my book too, which I'm always talking about people to go buy my book as well. So tell us about your book. What's the name of it?
Yeah, so creating well-being and building resilience in the veterinary profession. A Call to Life was a CRC publication in 2022. And it's really, how did we get here? What have we learned? What's the language so we can level set? And
Yes.
with that, what is veterinary centric? What is about caregiving that we should just collectively understand, like secondary traumatic stress, about empathic strain? But there
Right.
are uniquities to vet med, such as euthanasia, financial considerations, et cetera. Then going forward a little bit into a more optimistic space, realistic optimistic space around, right, okay, if these things are so, what are the toolbox building skills strategies that I'd want to offer for people to chew on, get curious about, build on, and
Yes.
shifting our perspective from one of doom, gloom, and kaboom to, oh my goodness, there is a different way of looking at this, where it's compassion, satisfaction, eudaimonia, that we're living into our meaning making, and ikigai, which is the Japanese for the meaning of your life.
Yes.
So shifting into positive psychology tenets, as well as look at all the amazing things that are happening in veterinary medicine, and where do you want to be in that conversation? So that was that book. I'm now in the mix, putting the practice book that always was intended to go with the first book. It's under construction, so that's probably going to be a late 2025, early 2026 publication again with CRC. But I'm excited. I'm
I
excited to
love
get
it.
back in the thick of it with conversations and thinking. And
Yeah.
oh, here I learn again.
Yeah, that's amazing. So is there anything that I haven't asked that we need to say before we start to kind of wrap this up? Is there
I
something I
love
forgot to ask you?
It's a question that I just love to ask. And I'd love to ask you, and you can ask me, but
Okay.
what are you hopeful about today?
Oh, so much. I'm kind of a optimistic person. I'm hopeful that this profession is going to continue to get better. And I'm hopeful that the people in the space that we're in of trying to help veterinarians and the experience that we've had loving. I mean, I always talk about how much I love vet med and how much my life has been fulfilled from being in this, veterinary profession. And I'm hopeful that others are going to start to catch that. And we're all going to, at some point in the future, really, really love vet med. As hard as it is and as tough it is, turn to the point where we really actually love it. And what are
Amen.
you hopeful for?
Amen and hallelujah to all of that, because I'm right there with you.
Yeah.
And I feel like what we are discovering is some of the pathways towards that. And that includes these community collective spaces of conversation. For an example, the AVMA having their very first DEIW summit. Wow, was that incredibly impactful and rich.
Yeah.
But there's really just a plethora of new spaces or spaces that are figuring out their way forward to contribute in a really meaningful way to mitigating some of the stressors that we know that we're going to be up against, mitigating the distress that we might experience, equipping us, level setting, decreasing stigma, and getting us individually activated so that we are in a space of, again, feeling optimized, as I bring that back,
Yes.
in
Yeah.
contributing to the veterinary profession that we all love so very much. I see it happening. And for those that are in a space of struggle, that you're not alone, there's ways forward, and there's likely folks around you who can help. So
Yes.
just
Like
know that
us.
stay with us.
Yeah.
Stay with us.
So tell them where to find you if they want to learn more.
I love if people would want to reach out to me through LinkedIn. I feel like that space has really been just a gift to connect with people and celebrate what other folks are up to and resource sharing. So you can find me, Sonja Olson DVM on LinkedIn. That's the place that I would recommend. My website is www.sonjaolsondvm.com. So if you're just curious about what I'm up to and I've been, where I'm going, because kids, that's a journey. I don't even know yet. I'm
Well, right. That's the thing. That's what's exciting about life is you really don't know. You don't know where you're going to end up next. And I mean, we would have not met except a mutual friend introduced us. So that's how we ended up here. And I really hope that you and I can do some more things together because I think we both have a passion for similar things. And I think we can get together and offer some more to the veterinary community out there.
Well, I know we will, Julie. That's the thing, is that when you connect with
That's what
people,
we're hopeful for.
right? It's just that you can sense it. You're like, we are actually cut from the same cloth, and we're right
Yes.
in this season of our life, we can see how we can partner. So
Right.
yeah, that's the other thing. Get curious, lift your head up, look around, network. That's
Yes.
the other thing about LinkedIn and other spaces is really getting curious about what other folks are up to, because it just might spark that, that's where I can maybe gain some energy and momentum.
Right. I love it. So everyone, this is Dr. Sonja Olson, and it's been a delight to speak to you. It flew by. I think we did over an hour. So I'm excited about that. And hopefully we'll get together again. And so if anybody out there really enjoyed this conversation, send us some comments and give us some likes and send us some questions. You can email me or whatever, and we'll try to come up with some more interesting things to speak about.
Outstanding. Julie, what a pleasure and a great way
It's
to
been a
help us
blast.
really just share this with others. And
Yeah.
friends, let's make 2025 really just a space of hope, of opportunity, and where we are showing up as our genuine veterinary selves.
I love that. I love that. So thank you so much. And everybody out there, have a beautiful week. Bye, Sonia.
Bye now.